It is common for patients with head and neck cancer to have a course of radiotherapy treatment. Radiotherapy may be used alone, with or without surgery, or in combination with chemotherapy. The radiotherapy X-rays kill cancer cells but can also harm normal cells too, so it's important for it to be planned carefully. Therefore, you will be asked to attend a specialist department called the Mould Room within Clatterbridge Cancer Centre. In order to make radiotherapy treatment as accurate as possible, each patient has a personalised mask. The mask is designed to help keep you still and in the same reproducible position. It is made from a flexible plastic called thermoplastic.
Once you've arrived in Clatterbridge, a member of the team will come and collect you from the waiting room. They will take you through to the mould room where the mask is fitted. Normally, there will be about 3 people in the room to help with the process of fitting the mould. Once you are in the room, a member of the team will go through the process and tell you exactly what is involved. At this point, if you have any questions, do not hesitate to ask. You'll be first asked to lie down on a firm trolley. This is so that the correct measurements can be taken. Great care is taken by the members of the team to make sure that you are positioned correctly, and you'll be guided throughout the process. You will be asked to lie back on a special mat, and the table will be raised to a comfortable height. You'll be asked to take off your mask, as that will impair the fitting of the mould. The straps of any top will be lowered down to the side of your arms, but you'll be covered over at all times to protect your modesty. A vacuum is attached to the mat you are lying on. This allows it to mould to the shape of your head and neck.
So Nathan's just going to pop your mask into the water bath now. It'll take 30 seconds to soften. You'll hear a few different noises as we're just getting things prepared. So if you just relax there as well as you can. When it is ready, and Nathan takes it out of the water bath, you'll hear him take off some excess water. It'll be quite noisy behind you. We'll then ask you to close your eyes so that we don't get any water into them, okay? Mm-hmm. When we bring it over, we'll let you know when it's coming, because obviously you won't be able to see. Mm-hmm. Just to make you aware, when it first goes on, it's flat packed, so it will squash the tip of your nose, but you can breathe fine. And we'll clip it all in and we'll alleviate the pressure on your nose as soon as we're clipped in. Throughout it all, we're going to ask you to make sure that you only communicate with us by using hand signals, because we don't want you to move your jaw once we get things underway, because otherwise it'll distort the shape of the mask. Okay. Nathan's going to take it out of the water bath now. If you relax your eyes closed for us. Okay, here we go, just nice and still for us. Try your best to keep yourself as relaxed as possible so that your chest isn't taut. You do have to do a lot of hands-on and pressing and prodding. Give us a thumbs up if you're okay. Okay, you're doing brilliant there. So the top section is setting beautifully, and the edges do take a couple of minutes longer. Just be mindful on your chest to keep it as relaxed into the bed as possible. As we said, our apologies for the prodding and poking. Just breathe away normally. Okay, you're doing brilliant. The setting in itself takes probably about 5 minutes in all. So we're getting there. If you keep still, then we won't catch anything, and we won't have any bumps or... Okay, happy? It's just a bit loud as we unclip now. Nice and still, lovely. Perfect. Okay. Once the mask is made, we will move through to our dedicated scanning department where a CT scan of your head and neck is performed. This CT scan is relatively quick and is performed with you lying down on the scanner bed with your mask on. To help us visualise the area that we may need to treat, you may require an injection of contrast dye. The radiographer will position you into your mask and set up the scanner. Once they are ready, they will leave the room to operate the scanner from the adjoining control room. They can see, hear and communicate with you at all times. The planning CT takes between 5 and 10 minutes depending on what is required. Sometimes patients will need additional scans like MRIs or a PET CT in order to make sure the radiotherapy treatment is planned as accurately as possible. The mask will be worn for this scan also and will often be done on the same day as the mask production and planning CT. Once you've had your mask made and the scans completed, these radiotherapy planning scans and any previous imaging may be used to plan your treatment. This will be done by your radiotherapy doctor, the dosimetrist, therapy radiographer and physicist. It is a timely process that will take between 7 to 14 days. There may be other pre-treatment appointments that you will have to attend, but you will be informed of any additional appointments at the time of the original planning notification. One of these additional appointments may be to visit our dental hospital at Liverpool Dental Clinic, which is next door to Clatterbridge Cancer Centre. If required, you may have teeth extracted on the day when you visit our dentist, but the dentist will discuss with you at the time of your assessment and explain what dental care is required with regard to radiotherapy. Other pre-treatment planning appointments that you may need to have before you start your radiotherapy are things like visiting our head and neck specialist nurses, our dietitians, speech and language therapists, and or chemo assessment appointments. If any of these are applicable to your treatment pathway, you will be notified of the date and time. When you attend for your radiotherapy treatment, the therapy radiographers will operate the treatment machine and they will explain to you what is going to happen and what is going to take place within the treatment room. You will be asked to remove any clothes and jewellery that may be covering the area that you are having treatment. The therapy radiographers will help you onto the treatment bed, position your mask and adjust the bed and align the machine into the exact position that are required. We will be asked to keep as still as possible. The radiotherapy machines are quite big, and if you haven't seen one before, you may feel a bit anxious. There is no need to worry. You won't see or feel anything throughout your treatment. Once you have been positioned for your treatment, the therapy radiographers will leave the room and operate the machine from outside. The treatment machine will rotate to different positions during your treatment without touching you. You will be required to lie still and to breathe normally throughout. A clicking noise will sound as the treatment is delivered. Each daily treatment session will take about 15 minutes in total, but this includes time for you to get changed, for the therapy radiographers to help position you into the treatment position, and for the actual delivery of the treatment. During your treatment, you will be alone in the room, but the therapy radiographers will be watching you carefully on a closed-circuit television system, and they can see, hear and communicate with you at all times. You will be given a paper copy of your treatment days and times, and this is usually a Monday to Friday. This list will also have any other appointments that you may have as part of your radiotherapy treatment pathway. Sometimes it is required to have a course of chemotherapy during the radiotherapy treatment. This will be delivered at Clatterbridge Cancer Centre, and it is given 2 to 3 times during the radiotherapy course via a drip. There will be a gap of about 3 to 4 weeks between each dose of the chemotherapy. If you do need chemotherapy, it will be discussed with you at your initial appointment with your doctor. Approximately 4 weeks after radiotherapy, you will receive a follow-up phone call from the head and neck team, and approximately 6 weeks after completion of your radiotherapy, you will be reviewed by your radiotherapy doctor.